Good afternoon. Thank you for being here. My name is Josh Rabinowitz, co-founder and CEO of Articulate Labs. Our work is focused on taking critical elements of physical therapy out of the clinic and into your normal routine so that you may improve yourself every day. Our story, as Chad alluded to, starts with loss and personal frustration. Herbie Kern lost his leg as a result of a motorcycle accident and then quickly developed osteoarthritis in the knee of his fully intact leg afterwards. If he didn't manage that knee pain, if he didn't manage that knee dysfunction, he would not be able to walk, to work, to do everything that he expected to. Like many others, he was too young for knee replacement. His only option was to work through the conservative options that were available for him, which were braces, medications, and injections, each of which came with their own drawbacks and their own lack of efficacy. What he did find to be effective was physical therapy, specifically quadricep strengthening in the course of that physical therapy to strengthen and improve the muscle that's responsible for distributing weight across the joint. However, lack of time and lack of reimbursement conspired to prevent him from getting all of the physical therapy that he required. It turns out, as we worked on this, that he's not the only one in this situation. 14 million in the US symptomatic and seeking treatment for this condition. There we go. So we have a lot of people who are in the exact same situation with the exact same frustration, looking for any opportunity they can get to work on improving their joints while waiting for a replacement. We believe we have an option available for them. We call it KneeStim. It's first an electrical muscle stimulation unit. It's a known, well-researched modality for accelerating muscle strengthening and re-education. Into that, we have integrated motion tracking hardware and machine learning in order to take this technology, or take this modality and make it mobile, to make it align with your gait, to make it usable during your everyday activities, whether it's walking or up and down stairs, going around the block, buying groceries. Every step becomes a muscle building repetition that's necessary for you to get the mobility and function that you desire out of your joint. What's unique about this is that, or what's unique about our device by comparison to what's currently available, is that use of motion tracking hardware, is that mobility. As you see in the picture on this slide, the current types of neuromuscular electrical stimulation units are not usable while mobile. You can't run, you can't move with those strings. We cut those strings. We make it so that you can rehabilitate when you want, where you want. We've been working hard to make this available to everyone who needs it. The two milestones we want to highlight today are that we have proof of concept data out of University of Texas and Baylor University, where we see positive changes in muscle activation and knee extension during just 6 minutes of operational use. We also have 4 patents issued on this technology that are extensible not just to the knee, but to other joints and other musculoskeletal conditions. Our dream is that in the future, to be able to take the same technology and use it to be able to rehabilitate shoulders or hips or lower backs. Before then, we have 2 major challenges. There are also 2 major value inflection points for our company, that if we accomplish these, we will do right by everyone who's invested in us. The first is getting regulatory clearance for our device so that it can be sold or prescribed in the United States. And the second is building a sales and distribution channel such that we can get this in everyone's hands. For the former, our goal is to get our FDA 510K application prepared by mid-year next year, and to have the sales and distribution channels set up by the end of next year. By the end of 2018, we want to be able to put a KneeStim on anyone who wants it or needs it. We believe that this is going to do well by anyone who puts money into this, not just because of the sheer size of the market that's there, but because of the unmet need, because there's such a strong desire for conservative, low-risk, cost-effective treatment that is not being fulfilled by the devices that are currently available in the market. By getting FDA clearance and by showing market validation, we also put ourselves in position to be potentially licensed or acquired by a larger manufacturer in orthopedics or orthotics. The people who are working on this are working day and night to make this a reality. Herbie Kern, as mentioned before, is not just a survivor. He's an accomplished engineer with 50 patents to his name and the expertise in control systems and embedded design necessary to make this a reality. My job is everything outside of the technology: operations, finance, commercialization, market development, and trial management. My qualification is that I finish every race I start. We also have a diverse advisor base around us that are double-checking every move that we make and make sure that we're doing right by our shareholders, and whether it's in the next patent we file, the next expenditure we make. They're there for us every time. Our ethos, again, to go back to where we began, is to improve yourself every day. And that's not just an ethos for rehabilitation, it's an ethos for our company. We invite you to ask us questions, to test drive our device, to challenge our assumptions, to push us to be better. And if you like everything that you see, if you like everything that we're doing and you think that we're on the right track, we invite you to share in our future, whether as a future patient, as a future prescriber, or a future investor. We'll be available at 1910 Pacific Place after this. We would love to have your questions and to talk with you more about what we're doing. Thank you for your time, and we'll talk to you soon.